The Charlotte Maxeke Hospital may be opening its doors on Monday, but more work needs to be done to get the 1,000-bed facility fully operational. The hospital's been closed since a fire broke out there in April. Now some sections will finally welcome patients again. The move will offer some relief to other health facilities which have been overwhelmed as the COVID-19 storm rages in Gauteng. eNCA's Nqobile Madlala has more.
Charlotte Maxeke became one of the first 4 of Gauteng's COVID-19 vaccination sites. But 2 months into the exercise, its doors were forced shut after a fire gutted parts of the hospital, with patients being moved to other facilities in the province. This prompted various groups, including doctors, to call for the facility to reopen as they were taking strain amid growing COVID-19 case numbers. On Thursday, the Gauteng Premier finally announced the long-awaited reopening, and this is what the newly fixed hospital looks like inside. Department of Infrastructure says it's confident that the new structure is sound.
The building will be fully compliant in terms of Fire Act, secondly in terms of Environmental Act, and thirdly in terms of structural compliance.
But that's not enough, though. The South African Human Rights Commission says this is the 4th hospital gutted by fire. It's time to fireproof these structures.
We have called for a holistic assessment of all healthcare facilities in Gauteng to ensure that they comply with fire and safety requirements. They also comply with the norms and standards as prescribed in the National Building Regulations.
For now, though. Well, it's been confirmed that parts of Charlotte Maxeke Hospital will be ready for use from Monday. Not all sections will be open, but for the oncology units, the parts opening means a world of good for the patients.
We used to treat roughly 160 patients per day on the radiation machines. We have 4 machines, it's about 40 patients per machine. And then in terms of our outpatient follow-up, that is in addition to the patients on treatment, it's about another 100 patients per day, give or take. And with the fire and being between 2 hospitals, that number was severely reduced.
Oncology says the opening of the hospital will see the department address the backlog of patients due for radiation. Nqobile Madlala, Johannesburg.